update, current situation, processing plants, and the first Minnesota cat. I'm Nicole Cass, the CE Program Manager for the MVMA and today's moderator. A quick reminder before we get started, if you do have any questions, please type them in the Q&A area and we will get to them at the end of the session. Today we are fortunate to have joining us Dr. Joni Sheftel, who's Minnesota's state public health veterinarian, and she leads the Zoonotic Diseases Unit at the Minnesota Department of Health. She's had a long-time interest in veterinary and agricultural occupational health. In addition to her DVM degree, she has a Master's of Public Health in Environmental and Occupational Health. For the COVID response, Dr. Sheftel is assisting the Minnesota Board of Animal Health on pets with COVID and is leading the workplace cluster response, working with other MDH epidemiologists, local public health, and Minnesota Department of Agriculture. Dr. Sheftel is currently serving as the immediate past president of the MVMA. Go ahead, Dr. Sheftel.
Hello, everybody. Can you hear me good?
Yes, we can.
Oh, good. All right. Well, I'm going to present kind of a potpourri of COVID information today, a little bit on the current human health situation in Minnesota, more about the processing plants where I've been really involved, and then a little bit on animals with COVID. And for that part, I've invited Dr. Courtney Mueller from the Minnesota Board of Animal Health to join us. And I know how busy practice is right now, so I really appreciate all of your participation. So I'm going to start by saying we thought we sort of understood this disease when it first hit our shores, and as a respiratory disease with a variety of symptoms, sometimes very mild, sometimes severe. But now we know it could be much more than that, and in fact, a disease that we don't really fully understand as of yet. What's come out in the last couple of weeks is that it can affect the vascular system, causing strokes in 30 to 40-year-old males, Kawasaki-like disease in children, which is a multi-system inflammatory disease of vasculitis, cardiac disease and heart attacks, and this weird thing called COVID toes, where people have been coming into their primary care physicians and dermatologists with weird blistery things on their toes. It turns out to be related to the COVID-19 virus. It can fairly commonly cause a loss of taste and or smell in people, and that actually happens as you're getting over the virus. And all of these different effects are because the ACE2 receptors to which the virus attaches are found on many tissues in the body, including the GI tract, so we see vomiting and diarrhea also. Minnesota now has over 33,000 cases with over 1,300 deaths. We've run over 500,000 tests. And so some people say, oh, well, the reason we have so many positives is because we're running so many tests. But what you can watch when you're watching this data yourself is to watch the levels of hospitalizations. Because you go to the ER if you're that sick, whether or not you've been tested. And so that's a much more even way to look at how much disease is really out there. And when you have asthma, not COVID. So when you look at our hospitalization rate, it is coming down a little bit recently, and that's almost scary for us because we know that we're not done with this yet. When you look at age groups affected, you can see that the people in working age categories are most commonly represented. They've been testing positive the most. But we know that people over age 60 are more likely to be hospitalized, and people over age 70 are much more likely to die. Although we just recently had a death in a 30-year-old previously healthy person. So I'm going to actually start talking about the processing plants now. It's kind of related. And this is a map of a cumulative incidence. That means all the acute cases that have occurred from the beginning of the pandemic through 2 days ago. And what you will notice when you look at this cumulative incidence is that the counties with the highest incidence are those with big processing plants. Nobles, Mauer, Todd, Stearns, Watonwan has 3 plants, Candy, Ojai. Now Rice is in there because of a great big manufacturer that makes industrial windows and a prison outbreak. But I want you to remember that this is, the cumulative incidence doesn't mean it's ongoing. So for example, and I'll show you another way of looking at this later on. But for example, Nobles County, the biggest processing plant outbreak with JBS, but that was way back in April. And because it's cumulative, it's still at the top of the list. This is a little bit old, this table. I made it last week, and in COVID time, that's like a lifetime. But it shows, just for your interest, last week, the top 5 counties were Nobles, Mauer, Todd, Stearns, and Candy, Ojai. Now Candy, Ojai has dropped down to 6th, and Watonwan is now where Candy, Ojai was. But looking at the number of plant cases in comparison to the total packing plant employees, so about 21% in these top 5 counties of employees were confirmed positive from the plants. But then when you look at the total county cases for those same counties, and the proportion of total county cases who are plant cases is around 38%. And among these, we've had 2 deaths, and there's actually been 3 deaths associated with meat packing plant employees. One was from another county, not listed here. Not that you want to get callous about any of these deaths. That's a low number of deaths for the total number of confirmed COVID cases. So this, you might want to ask yourself, why are meat packing plants, in the news? Why is there so much interest on them? Well, these critical infrastructure industries like meat packing plants and other food processing plants, construction, et cetera, they were ordered to stay open and operate when other businesses were ordered to close. Masks and other personal protective equipment were not available. Testing was not available. The tools that we use to limit employee illness were just not available yet. And when people work closely together in one environment, the plant can serve as a virus amplifier. So the pandemic hit Minnesota before the physical and operational changes to accommodate distancing, which we don't call it social distancing in a workplace, before distancing could be widely implemented. So we started outreach to the meatpacking industry before the problem hit Minnesota and developed a state guidance with the Department of Agriculture, the Board of Animal Health, and the Department of Labor and Industry, which is OSHA for you practice owners. Since then, we've consulted with over 30 swine, turkey, beef, and chicken plants, both remotely and on site. And of course, the Department of Health does not regulate these folks. They are regulated by USDA. So these are non-regulatory two-way learning situations, which is really how my group, operates anyway in non-COVID times. We don't have regulations, and we really try and prevent illness basically through education and outreach. So it's really my thing to be doing this, and I'm been very challenged, but also really rewarded with this work, because these plants have continued to contact me as things come up and as guidances change and as they want further advice. So I think I've been valuable, and that makes me feel good. So through all of this work with meatpacking plants, we learned a lot about preventing illness in large workplaces. And a lot of that is what I'm going to share with you today. And although veterinary clinics are not, by and large workplaces, the principles all apply, and I'm going to talk about that a little bit later. So how this works, just protocol-wise at the health department, is we have our epi surveillance people. When people have COVID and they test positive, they're interviewed by the health department and they're asked where they work. And so that's in our database. And every day, the database is mined for workplace clusters of 3 or more cases. And then those are distributed and information is gathered about them. We have a conference call or a WebEx or something, talk with the management, we have a consultation, we share resources, and then we have a point of contact for the future. So this is how we divide all these workplaces. So I'm on the meat side, as we call it. I take the USDA regulated meat packing plants. The Department of Agriculture has stepped up unbelievably, and they are leading these calls with all of their MBA regulated facilities, and these are many in the state. They regulate the veggie processing plants, the dairy, as you know, processing plants, dairy farms, custom slaughter, grocery stores, and the store delis inside those grocery stores. Those are all regulated by MBA, and they're doing the same kind of outreach that we do for other kinds of businesses at MPH. And they even are, normally the state agencies really stay in their lanes, right? And human health is Minnesota Department of Health, and very few agencies have wanted to get into our lane. But we asked specifically if MBA would be willing to provide guidance on even the human health side of, like when COVID positive workers can come back to work and, this sort of questions. And they have stepped up to the plate and they're taking care of that stuff. Now, for the really big ones, then we have a subject matter expert. Anyone on our workplace cluster team will join their team for these calls, but they lead them. The restaurants are filtered to Minnesota Department of Health, Environmental Health, and then general business and manufacturing plants are assigned to local public health through our field epidemiologist. But the really big ones I often take as the meat packing plant problems are kind of getting a little bit less visible. Some of the bigger other kinds of businesses I've taken because I can act as a word seeder and get their attention. So when we identify a facility with COVID positive employees, either through this surveillance system that I just described or through a complaint, we set up a call. Either Department of Health, Department of Ag, or local public health leads the call. We get plant management on the call, the county public health director, and the MDH regional field epidemiologist, and often the medical clinic. When I say plant management, I am so impressed with who these plants will get on the call. We get their owners, their COOs, their CFOs. We get the real decision makers for those plants on the call. And that's why I think we've made so much progress, is the people who can actually listen and then make decisions are on those calls. We go through the best practices, we find opportunities for improvement. People are very upfront. And then we set up a local team that involves our field epidemiologists, which is really kind of the same as the Board of Animal Health District vets. Same kind of people, they're people. They're they have a region and they're connected up with the local people in the area, the county public health department, the plant, and the local medical clinic. And we set up this team. And I'll talk about exactly what the team does. I think that slide's later. What we want to do is we want plants and businesses to adopt an ongoing, sustainable system of testing based on intensive employee screening with a low threshold for testing symptomatic people. And what I mean by that, is that COVID has a really wide range of symptoms, everything from super mild, a person with a very mild sore throat, to on a respirator. So our thresholds at the beginning of this disease were too high for calling somebody a suspect COVID. We don't, 30% of our cases don't have fevers. So you can't go by the fever, 100.4 or higher. And of all the best practices there are, and of all the ways to prevent illness in employees, and includes vet clinics, employee screening, every employee, every shift is the most important thing you can do. It's really a two-step process. The first step is initial verbal screening with 5 symptoms, which are cough, fever or feeling feverish, sore throat, muscle ache, and tightness of your chest or difficulty breathing. And the temperature screen is much less important, and not even in a small vet clinic critical to do it all. Like I said, 30% of people do not report a fever or feeling feverish who are COVID laboratory confirmed positives. So that's step one. And if someone says yes to one of the symptom questions, or their temperature is above 99.5, a screening temperature, meaning that's the highest normal human temperature, you go on to a further evaluation, which doesn't have to be an OC health nurse at all. It could be just you taking an employee into a private place and figuring out what's going on with them and seeing if they need to go in for testing and to home, to a medical clinic, or if they're fine to work. Many people with a 99.5 temp are fine. They just bicycle to work or something, but you need to figure out what's going on if somebody doesn't pass that initial screening. So this is our, we have some documents. So right after screening, employee screening, the next thing in importance is distancing. And we often have to go through this whole explanation of how COVID-19 is spread. It is spread from person to person through respiratory aerosols. Those are aerosols that are produced when we just even talk or cough or sneeze. But you know, you don't have to cough or sneeze, it's just talking. And the importance of environmental services has been way overblown. When it first came, all you heard about was washing your hands and hand sanitizer and using disinfectant wipes on everything. And you know, that can't hurt for all kinds of diseases. But this disease is spread through people being nearby someone else who has the disease. And that's why the screening is most important to keep sick people out of your business. And secondly, the distancing. So if they do get in the door, that you're standing 6 feet or more from them. Most large businesses and facilities have now made substantial changes to their physical plants and to their operations to accommodate distancing. And during these calls, we ask plant managers to share their innovations, and we kind of grab those good ones and we go over ideas with them that have worked in other facilities. So it's all kind of a big sharing process. When you're thinking about distancing in a business, whether it be very, very large or very, very small, it's important to observe people working and moving and to identify areas where employees congregate to ensure that, I use the word social there, to ensure that distancing is possible in those areas. Sometimes there are lineups of blobs of humans at the hand washing sinks, the locker rooms, donning and doffing areas for personal protective equipment, break rooms, and then coming in the door if in a big enough plant. And one place had the coolest idea, and I actually visited this place. It's not a plant, not a meat plant, but I wanted to see what a distribution center looks like. They had used their crates that are normally on the conveyor belts going all over the place and built them up and made kind of a maze that employees have to go through to get in into the building from the front door, so that they're forced to go in single file and stay 6 feet apart. It's really innovative. Next in importance, number 3, is personal protective equipment. And at this point in the pandemic, it really needs to be mandatory that everybody wear a cotton mask or a disposable face covering. We have to call surgical masks that. And what we mean by disposable face covering is really just a surgical mask. You know that the N95 masks are available only to healthcare. This is critical. And then anywhere where people have to lean in, work really closely together, where it's possible, people should be wearing face shields in addition to masks. And this includes areas where barriers or distancing is not possible. You still have to be able to do your work. So I'm just not sure if you're working on a fractious cat or dog that having a face shield on is going to make you safer, because it could really get in your way. And of course, training on proper PPE usage is really critical. So as far as testing goes, we recommend, like I said before, ongoing testing of symptomatic employees, even those employees with very mild symptoms, and immediate access to testing. People in critical infrastructure industries, such as meatpacking and such as veterinary medicine, now have immediate access to testing if you say that you're a critical infrastructure employee. If you have any trouble, that's where we can help you at the health department to navigate the medical clinic that you're trying to get tested in. Generally, we don't recommend testing everybody, both the symptomatic and the asymptomatic employees in a workplace, but there are times when it should be considered. And one time is when you suspect that there's ongoing transmission in the plant because there's been an increase in positive cases within a short period of time, relative to the size of the workforce. And, you might see clusters within the workplace, like a supervisor and 3 people on the ham line or something like that are things we've seen. A lot of times the actual transmission is going on in the community and they're spread into the plant and spread from the plant out. In small towns where the plant and the community are really almost the same thing, it's hard to tell what is going on exactly. But there's also another thing, which is what I call the employee relations tipping point. And that is when there's enough illness in the plant, regardless of how it's getting there, where employees are afraid to work and employees are mistrustful. You get to this tipping point where employees are mistrustful that their employer is watching out for their safety adequately. And then the employer is resentful that people who are perfectly healthy and willing and able to come to work aren't willing to work because they're so afraid. And you get to this impasse, kind of emotional impasse. And there's another time that whole plant testing seems to break that cycle. Here's an example where whole plant testing was really helpful. This is a plant with 636 employees. And we started getting involved when we started seeing this rise in cases. And, but it took a little bit of convincing and a little bit of talking to get get the plant to test all their employees, partly because in Minnesota, unlike all of our neighbors, the plants have for the full employees. So it's not, and it's a lot to ask employers to do. But anyway, so things are not, and then set up, the plant set up testing through their local health department, to the local medical clinic days here, this tall spike. And those were people were very mild or were asymptomatic. And we have that kind of situation going on. All whole plant testing seems right down like you see here. So when we have these plant county public team, the MVMA facility on best practices, facilitate testing of the medical clinic, a template release form to sign it.
Dr. Sheftel, I think we lost your audio. Dr. Sheftel, can you hear me? Bear with us. It seems that we have lost Dr. Sheftel's audio. So we're going to try and figure out what is going on and how we can get her back. If you'd like, Dr. Sheftel. Oh, are you there?
Yes, can you hear me now?
Yes, we can.
Did you ever lose me?
Yes, we did lose you.
Uh-oh.
Yeah, so we were
call in on the phone.
No, I think we're good now.
Okay, if it happens again, I've got my email, because I won't get email either without my internet. All right, well, so in human medicine, when you have the disease, you are isolated. And when you are exposed to the disease but you don't have symptoms, you're quarantined, which is kind of the opposite of the animal side, where if all your birds have high path AI, your farm is quarantined. Or actually, the birds are quarantined. Okay, so plants have done a great job with uptake. And they've learned a lot through their experiences both here in Minnesota and in other states. Double check that I'm still on the internet here. Yes. Okay, so what they've learned is that they figured out what interventions they can do so that if somebody in their plant comes down with COVID, they will so-called take out fewer other workers, you know, through this process of contact tracing and excluding people who've had concerning exposures to the COVID positive person. In general, the operational and physical changes to accommodate distancing and barriers are well done. Almost most plants require both a mask and a face shield, particularly when 6-foot distances cannot be maintained. And what we found out is that having everybody in a mask does help prevent transmission. But when you have people in a mask and a face shield, that really stops transmission. Because the mask is, we call it source control. The mask protects other people. And of course, so if everyone's wearing them, everyone's safer. But the face shield actually also protects the wearer. And challenging situations are when employees are coming and going during breaks and lunch and employee screening. Okay, so here's the kind of one thing we're trying to do is teach the management of large facilities to think like an epidemiologist. So I, over the phone, taught one of the one of the plants to make what we call epicurves, which is just the number of cases over time. And you can see here that she on her own did both of their positive cases and of the people that they had screened out, meaning that they've come to work, but their screening system had detected that they either had a symptom or a fever, and they sent them to be tested. So you can see that their screening is doing a good job because those people, you know, tended to be positive. And she wrote me this note: I've continued to chart our daily numbers. The small spike of positives on 5/21 would have been our on-site testing. Thank you for teaching me about epi charts. We call them epi curves, but it's cute. So they did testing right here, and they did testing not because it was scientifically valid, but because they had reached that tipping point where their employees were reluctant to come to work and the management was frustrated. Everybody was frustrated. The media was going on about the number of cases they were having. And so they basically had no choice but politically, but to test everybody. And out of over 300 some people that they tested, they had 8 positives. But it did do the job. It calmed everybody down, which is, you know, as a scientist type person, actually I'm a lot of it, what I do is policy, so I get this entirely, but it's certainly frustrating for people who like science. So I asked some of the companies I've been working with to send pictures of what they're currently doing to protect workers. And these are about a week and a half old, and they are just went on the line and took pictures. And so this is JBS where that first outbreak was. And when I was there, I was there with 2 of our other EPIs, and we did a site visit, and they had these up, which are kind of brilliant because these are trash bags and they can be replaced between every shift. But they didn't have the barriers this way when I was there. And you can see that they're wearing both face shields and masks, and they're really decked out. So it's hard to, you know, say that, oh yeah, this person's really at risk from this person when you see the setup that they've got here. Here is Jenny O Turkey Store. These folks are also wearing both face shield and masks. There at Jenny-O and Hormel too, because they're all owned by Hormel. They have these green dots on they have color dots on their helmets. They cohort workers so that they come in together, take their breaks together, take their lunches together. And so then if somebody gets sick, they don't have a whole bunch of other people that have potentially been exposed. And you can see that they reassign lockers. So you can only take a locker according to your helmet color. And you can see like this red and this red are way more than 6 feet apart. And that's one of the types of things that companies are doing to increase distancing. And here you can see that this group, they've got their staggered start, break, and lunch times. Here are the lunch rooms. The plants I've seen and talked to on the phone, they basically all have these barriers now that allow, that protect workers and also have 6 feet of distance. This is Pilgrim's Pride, the chicken processing plant in Cold Springs. Here they have really kind of massive dividers between their employees, including this way. And these employees are wearing masks. They had trouble with face shields that they were clouding up, and they thought they were going to have more knife injuries with them than without them. And but their cases have almost stopped with all of this stuff going on here. So I wanted to show you, this is another look at the incidents. This is a look over for this week versus last week. And you can see many of the same counties, Mower County with Mower County that has QPP and Hormel, and here's Nobles that looks so bad on the first incidence map. Their week to week incidence is dropping. So you can see many of the meat processing plants are, we've seen fewer cases in those counties. So what we've seen is that as other businesses are opening up, we're seeing COVID cases and clusters in many types of businesses. So far we've responded to clusters in 32 meat plants, 44 veggie and other plants regulated by MVMA, 24 restaurants, 102 manufacturing, distributing, and other businesses. And these are getting bigger all the time. But we're applying the same team approach to all of these workplaces that we did to the meat packing plants. Now we have personal protective equipment, testing, and COVID guidance to help limit spread. And our policy is to keep these businesses open and running. Early on, you may have heard that plants were closing down, and that was not due to Department of Health or any other state agency closing them. That was because they did not have enough workers to run their shifts, and it was a business decision made by those plants. We don't think in public health that as long as you're doing all the things that I just showed you in those pictures and transmission inside the plants is controlled, there's no reason to send people home from a plant like that to a community where the virus is circulating. It's no different. Also, as veterinarians too, we're really aware of the upstream effects of plant closures on Minnesota livestock producers. The absolute, who would have thought that a human pandemic that, could affect animal agriculture in this way? So, pigs, they're all lined up to come to the processing plant. And if they're in flows of animals, and if there's no processing plant to go to, there's nowhere to put those pigs. And you can only keep them so long. And so through this pandemic, as of 6/9, there have been 260,000 market weight pigs euthanized and 160,000 market weight pigs given away, where the farmer just gave them away to people who could slaughter them themselves or people who would bring trucks and bring them back to a different state. The normal cost of producing a pig is $130. So you can see the loss to these producers is immense. What I learned was that processing plants have now recovered to about 88% capacity. 1 month ago, they were at 55%. And so there is still a problem, but they think within 2 or 3 months, we will have caught up with it. Said all of this stuff. So as far as veterinary clinics are concerned, there are, early on, there was some guidance for veterinary clinics put out by Board of Animal Health and Department of Health. And now veterinary clinics are kind of being just organized for all in the area for all businesses. And I know I'm sure you all know that you're supposed to have a COVID plan in place. And there is a template plan that works fairly well for veterinary clinics. If you have any questions about that, feel free to call me and ask me, or call me or email me, and I'd be happy to help with any questions that you have. Now I'm going to move on to COVID and pets. And kind of thank goodness, CDC has taken the stance that there's no evidence that pets play a role in spreading COVID-19 to people. There is no evidence, even though they tend to take a very cautionary approach. They can definitely stand by that, and it's definitely true that people with COVID should restrict their contact with animals, because we know that there are certain animals who have gotten it from people. But luckily for people in animal agriculture, there has been some research to show that livestock, including poultry and pigs, are resistant to the virus. Dogs appear to be relatively resistant, although there have been several symptomatic and asymptomatic dogs identified with COVID. Cats and ferrets are susceptible. And the first animal we had here in the US was a tiger in the Bronx Zoo that tested positive for the SARS-CoV-2 virus that causes COVID-19 on April 6th. It was the first animal in the US. And then on April 22nd, these are report dates, so the actual illness onset dates for these animals is prior to that. 2 cats in New York City were reported. These were the first domestic animals to test positive in the US. And if you'd like to read the MMWR, I've got the link for you. And since then, it's been shown that dogs, cats, zoo tigers, and lions, and farm mink have been infected naturally with SARS-CoV-2 from human sources. Experimentally, when especially given fairly large doses, ferrets, golden Syrian hamsters, Egyptian fruit bats, and cats have been shown to be able to transmit the infection to co-housed animals of the same species. I love that word conspecific, so I had to put it in there. Remember that it's people who give the infection to their pets. So when you're giving clients advice, it's really important to tell them, particularly with cats, to limit your contact with pets if you are sick with suspected or laboratory confirmed COVID-19. So June 1st, the first Minnesota animal was a symptomatic 3-year-old female spay Bengal cat from Carver County. That's my county, was reported. Dr. Courtney Mueller at the Board of Animal Health did the animal follow-up, and she sent a really great veterinary alert to all the veterinarians in Minnesota. You should have received it with clinical details about this case. And she's here to answer questions for you today about this case, and also I thought there could be animal testing questions for her, so she's been kind enough to be available. So the Board of Animal Health did the animal follow-up, and then I interviewed the owners to confirm an association with a COVID positive person. Let's see where I'm next. So I just, because you're probably interested, because it's a Minnesota cat, I thought I would tell you a little bit about the situation where the cat got sick. This was a household with 2 adults, a male and a female. The male household member works in landscaping with his brother. They share a work truck. The brother was positive first. The male household member illness onset and test positive date was on May 3rd, 2020. The female household member tested negative on May 3rd. Her probable COVID onset date was May 10th, but her illness was less severe with cough, headache, and muscle ache, and she was not tested while she was ill. Both of them lost their sense of taste and smell for 2 weeks after being ill for 1 week and already recovering. And the cat was much closer to the female household member, and the cat's illness onset was May 19th. So that was 10 days after her cat's owner's onset date. So I thought the dates were really spread out and interesting for that reason. 5 days following examination and treatment, the cat and the owners were reported to have recovered. There's one dog in the household which has remained healthy. The dog, interestingly enough, was super pals with the cat. They played and slept together all day long. The Minnesota Board of Animal Health and Department of Health recommended that the cat remain isolated at home for 14 days following the positive test result. And that's CDC guidance there. So the cat, I'm just going to briefly, you can ask more questions of Dr. Wheeler if you have more questions. The cat was an indoor-only 3-year-old spayed female Bengal cat presented to the attending veterinarian on May 20th, 1 day after onset of illness, with 105 temp and harsh lung sounds. And that to me was surprising because when you read about other case reports from symptomatic COVID cats, they tend to have really mild disease. So actually, when I heard about this, I doubt it's real because the temp is so high and the cat was so sick, but it was COVID. So 105 temp does not rule out COVID. The veterinarian reported that the historically aggressive cat behaved very calmly during examination and specimen collection, which I found really interesting because people, ER docs will tell you that people with COVID are way easier to deal with than people in ERs with other stuff. And so I thought that was interesting. And again, Doctor, I'm very soon done here, and then there'll be time for you to ask Dr. Wheeler more questions. There is a board on the Board of Animal Health. There is a Minnesota policy for animal testing. I just wanted to finish up with just a little bit about COVID and vet clinics. And I would say that preventing illness in employees of vet clinics is more difficult than in many other fields. And the reason is that employees work very closely together. Obviously, one person's holding a dog, and the other person is examining or treating the dog. You are right near someone else. And I'm not sure that that kind of work is conducive to a face shield. Everyone should be wearing masks. But so you work closely together with other people. There are small spaces. You know, the vet clinics tend to be relatively small and not huge space things with high ceilings. Exam rooms are teeny tiny. And then oftentimes there's not that many people working at a vet clinic. So if you have people getting sick with COVID, you're going to have staffing shortages. That's really, really a big problem. But the same principles apply to preventing illness. Employee screening and testing is number one. And even though you have a small clinic, you all know each other. Somebody should be screening employees with those 5 verbal questions every day. Even though you tell your employees 1,000 times, do not come to work if you have any of these symptoms. Call us if you have any of these symptoms. People in Minnesota still come to work. And think about yourself. So, but when you look them in the eye and ask them about those symptoms, they're way more likely to say yes, even though they've shown up at the door. So employee screening is number one in importance. Distancing where you can and personal protective equipment. If you need any help, feel free to call, particularly when someone tests positive. So thank you all very much, and now we'll take questions.
A reminder, if you have any questions, to please type them in the chat area. We'll give you guys just a moment to type them in.
And Nicole, if you could read the questions, because I cannot see the chat for some reason. I'm afraid to punch any buttons and exit by accident.
Not a problem. Do we have any questions? Everybody's kind of quiet so far today. Give them just a moment.
Testing from the Board of Animal Health.
Do we have any questions about testing for Dr. Wheeler? Give people just another moment here.
I know people are very, very busy.
Yeah, if you want to email me questions after the fact.
So Dr. Wheeler said, if you do have any questions, you can feel free to email her. As you can see, Dr. Sheftel shared the email information for both herself and Dr. Wheeler. If you're feeling like your question's a little more in depth and too much to be answered at this point in time. Looks like we do have a question. So quick question is, if you want to test dogs and cats, what's the best place to start?
Sure. This is Dr. Wheeler. The best place to start is to consult with us. You can actually contact me directly. I have a questionnaire that I fill out, so I'm sort of screening all of these using similar routine questions, and then I run that by Dr. Sheftel and Dr. Beth Thompson, and we come up with a decision to recommend testing or not recommend testing based on several factors, including symptoms that the animal is displaying in association with infected persons in the household. There's a CDC's got some really good definitions for what contact means between an animal and a person, and so we sort of look at that and make some recommendations. But if you have any concerns or questions at all, feel free to reach out to me, and I can get that ball rolling. You can email me. I can provide my cell phone number if anyone needs it.
Thank you, Dr. Wheeler. Any other questions?
Thank you, Courtney, for being on.
Oh yes, thanks for having me. It was really interesting, Johnny. I did want to point out with this case, what I found really interesting is that this cat was co-infected with Mycoplasma felis, and I just think that's something that all veterinarians should ponder. Did this cat somehow have a suppressed immune system that made it more susceptible to the infection, or which came first? I found that extremely interesting in this case.
At MMWR that I gave the link for, one of the other cats also had M. felis in that report. So I don't know if it's just that common or if there is a connection of some kind.
Okay, I've not seen any other questions at this time, so thank you guys both so much for your time and your expertise and all you've been doing each day. I know you guys are putting in a lot of extra time.
Thank you, Nicole, for having me.
Take
Thank
care,
you.
everyone. Stay safe.
You too. Bye-bye, everybody.